I lived in Nepean and brought my family up in Nepean, and from time to time we'd have cuts and scratches and broken bones and all this kind of stuff, and we'd go to the Queensway Carleton Hospital and they'd fix us up and send us home.
Queensway, over the 10 years that I've been there, has grown from being a small community hospital to becoming a very significant healthcare player in Western Ottawa.
I think if I was talking to you as somebody who didn't know anything about the hospital, I would talk about 400,000 West End residents. I would talk about the 2,500 brand new babies that are brought into the world every year at our hospital. I would talk about the importance to reduce personal anxiety when you're going through cancer treatment to have access to care. And the hospital often doesn't seem relevant until you need it. And then when you're there, suddenly it's the most important place for a critical period of time.
I was up in Quebec at my summer cottage, middle of the summer, got real sick. Had a neighbor drive me into town to the hospital. They came to me and they said, "We don't know what's wrong with you, Mr. Beach. If you'd like to go home, if you get any worse, you can come back." I went home, spent 2 days just sick. I couldn't get any sicker, so my next door neighbor, the doctor at the Queensway Carleton Hospital, I can hear he's out cutting the grass. I hear the lawnmower going up and down, and I said to my wife, "Go down and ask the doctor if he'll come up and see me here." The doc come clumping up my stairs, and "What's the problem, Gary?" And I told him the story. He called ahead and had the best surgeon that was available at the hospital. He knew what was wrong with me, on standby. I had peritonitis, appendix, was in the hospital for nearly 2 weeks. So I wasn't too happy with the first hospital that sent me home. I was real happy with the second hospital that fixed me up and sent me home, which was the Queensway Carleton Hospital. My father ended up in the Queensway Carleton Hospital and spent the last years of his life. He died in the Queensway Carleton Hospital after receiving a year of the best care a person could possibly imagine to have for their father. That made me feel great. But you get to be a certain age and you say to yourself, you know, I'd like to do something special for my community. Well, Queensway Carleton Hospital, a great hospital, but they also do a great thing. They help sick people get well. What a great way to do something special in life, to help other people, than to fund a facility which helps sick people get well so they can go back into society and go about their business. It leaves a legacy for myself and my children and my father, grandfather, and my great-grandfather, all of which, by the way, were all named James Beach.
There are lots of very high-quality people in this community. And some of them are generous to the Queensway, and we're grateful and lucky to have those folks as part of the team. Gary's a good example. Gary had the courage to take a risk that a resource available to him might have an impact, and he wrote a check. I'm able to then take those resources and create something that's useful and lasting and has impact. His gift was a $5 million personal check in support of a building that we call the Beach Healthcare Center. It's a 120,000 square foot addition to the hospital that includes 10 brand new ORs, best in the city at this point in time, with all of the various support spaces that go with that, the recovery rooms, the preoperative spaces, the instrument processing spaces. These are revolutionary changes for the Queensway.
It's a great facility, great hospital, and I'm really happy with what I've done. And I think that if you're searching for a charity you'd like to help out, it doesn't get any better than that.
The Queensway over the last 10 years has become very good at change. They understand the power of change, the potential that it brings to the community that we serve. There are patients, family members of ours, who are enjoying healthcare benefits today that were not in existence, either scientifically or physically 30 years ago. And that's because members of our community were insightful enough and generous enough and courageous enough to support an initiative. And the impact is that we have healthier people today, people who, quite frankly, wouldn't be around today, that are living healthy lives with bright futures.